Hey guys, this is Troy. This video is going to be a brief introduction on how to use the testosterone and how to do the injection yourself. We're going to have a separate video that'll teach you how to do the growth hormone, the HCG, or the MIC-B12 if you're taking any of those medicines. This will be simply just introducing you how to use and draw up testosterone, and we're also going to talk about the Arimidex or the anastrozole, which is the estrogen blocker. You should have gotten medicines to your door, and I'm going to talk about exactly what you'll need in order to start these injections on your own. The reason that we're doing it on the video is because it minimizes time for Nick and I to meet with each person individually. If you have questions after watching this video, please don't hesitate to come in and meet with us and we can go over this with you individually. But it is very easy to do, and it's very, very simple, but we want to make sure that you're safe and that you're doing this the right way. So first and foremost, as you got your box, you'll see that there's a little box in there, and that's going to house the testosterone. And each bottle of testosterone should look very similar to this. It should say testosterone cypionate on it. And the first thing we're going to do is just review the testosterone. Each bottle has a little plastic cap on top of it. There's a little cap, and you'll just simply pop this off with your thumb. This one doesn't have one, but you'll just pop it off. Then you should see this rubber stopper right here. So first thing we'll do is pop that little cap off. We see the rubber stopper. And then what I like is to clean things. This little rubber stopper right here, there's bacteria on it. We can get bacteria on it from our fingers or the air. And each time we draw, the first thing we want to do is just sterilize this rubber stopper. And what I like is just good old cotton balls and some alcohol. So just good old alcohol, and this is a nice one. You just kind of squeeze it. The alcohol squirts onto the cotton ball. And I want it to be wet enough so as I squeeze it, there's a couple of drips that come out. So we use it, quite damp. It's pretty full of alcohol. And the first thing we'll do is we'll come over to this bottle and we'll just clean the top of it with this alcohol swab. And we're going to set it down and just leave it alone. And that's going to sterilize the top of it. Now, if you happen to touch the top of it again, just go ahead and clean it again. And that'll keep things sterile there. Now, the next thing we're going to need to do for the testosterone is get a syringe and 2 needles. Nick will have these available for you here at the office. You'll need to pick a bag up and they'll be set for you. If you have other medicines like HCG, growth hormone, peptides, or MIC-B12, those syringes and needles will come to you along with your medicines. But for testosterone, you'll need to pick those up here. And what you'll see is there's a 1 cc syringe, looks like this. And you'll see on the back of it, it'll say tuberculin syringe, 1 cc. And then each time you draw and inject, you're going to need 2 needles. There are 22 gauge needles. You'll see it says 22 gauge, 1.5 inch needles. You'll need 2. And you can pull them apart, 1 to draw with, 1 to inject with. Now the reason that we use 1 to draw with and 1 to inject with is after we draw the fluid out, we're going to push that needle through this rubber stopper. These needles are so cheap nowadays, they get dull after just going through that rubber. Then when you try to inject yourself, it's painful and oftentimes doesn't even go in, it almost bounce off of you. So they dull really, really quickly. So the first thing we're going to need to do is have the syringe and 1 needle, and we're going to need to join these 2 together. And if you look at the packages on these, the packages have little flaps on them that show you which side to open. One side has flaps, one side does not. So what we're going to do is just peel back these flaps and open things up. But first and foremost, as you look inside here at this syringe, there's one thing I want to point out, and that's the end of the syringe right here. This rounded end is called the barrel. And we actually, when we pull this syringe out, we don't want to touch this. It needs to maintain sterility or be sterile, so we don't want to touch this with our fingers. Likewise, once we get the needle out right here, here's our needle, and you can see this rounded end here. These 2 are going to join together. This is called the hub, and we don't want to touch that with our fingers. If you happen to open up either one of these and touch one of those areas, just throw it away and get a new one. These are relatively inexpensive. So if you touch those things, it's okay, just get rid of it. So the first thing I do is peel back these little flaps on the syringe, and then we're going to peel back the flaps here on the needle. And again, being careful not to touch the hub right there. I'm going to pull this syringe out, and you can see these don't screw together. They basically just snap together. So what we want to do is join these 2 together, and then some light pressure to join them together. Now, don't push the needle this way because there is a chance that that needle could break through that plastic and go right through your hand. The reason I say that is because I've done it. So I prefer that you hold the needle here and just with some gentle pressure and just a little twist, push those two together, and now we have them joined together. Now your dose instructions will be on your bottle. It'll tell you exactly how much of this to inject. If you have questions, give us a call. But it'll be right here on the bottle. It'll usually tell you exactly how much to inject. So if you have any questions on that, just give us a call. Your bottle individually will tell you how much to inject. And again, if you have questions, just give us a call or a quick email. Now we have these joined together. What I'm going to do today is I'm going to be injecting 0.6. That's where most of us are going to be, is around 0.6. This is a 1 cc total syringe. So you can see the numbers on here. And this syringe, you can see right here, as I pull this back, there's 2 rings. And we're going to measure from the most distant ring to this syringe portion here in the back. It's going to be this ring that we measure from. And I'm going to pull that back to 0.6. And hopefully you guys can see that okay. See it okay in the video. So 0.6, so I pulled air in here, and what I'm gonna do then is I'm gonna grab the bottle of testosterone, making sure I don't touch that rubber stopper. If I do, you can just clean it with alcohol again. I'm gonna flip it over. And as you flip this over, you can see this little rubber portion here at the bottom, there's a groove in it. So we can actually see the needle as I put this in here. So I'm gonna go ahead and pull this needle off. I'm going to slide it in, making sure I don't touch the rubber stopper or the needle. If that needle touches your hand or this metal part, just get rid of it and get a new one. We're going to go ahead and just slide this in, and you can see the needle inside that little trough inside there. Now, I'm going to spin the bottle a little bit. You can see here, if I push this too far up and I try to draw things out here, you can see where the needle is. It's not in the fluid, so I'm not going to get anything out. So I'm going to bring it back down here into that little trough. I'm going to go ahead and inject that 0.6 cc's of air into the bottle. And then I'm going to just pull back on the syringe. And you'll see the fluid is very thick. It's viscous, almost like motor oil. I'm going to pull back beyond 0.6 and just kind of hold this here and let this fill up. And you can see the bubble that's in there right now is slowly getting smaller and smaller. I'm going to continue to pull more in here. And then I'm going to push that bubble out at the end, and just keep pushing fluid back into the bottle until I'm to 0.6. And now we have the testosterone drawn up. So I can pull this out. I don't want to push this needle into the cap because I've missed before and I've hit my hand. So what I'm going to do is just drop the cap on this needle like this, click it back on, and we're going to need to exchange needles now. Again, we don't want to inject with the one that we just drew with because it hurts. And it's dull. So we're going to be very careful not to touch the syringe now that it's loaded. So I'm going to go ahead and peel this needle off and discard it. I'm going to go ahead and open up another one, again being careful not to touch this hub portion through here. And I'm going to go ahead and marry these two up. Little pressure again. And now it's actually ready to inject. We have a fresh needle. We have 0.6 cc's of fluid, and we are all set to go. Now, there's 3 points that we can inject this at. There's 3 areas. It's an intramuscular injection, which means we want it to be about 1 inch into the muscle on average, roughly about 1 inch. We can inject directly into the side of the deltoid. We can inject into the upper outer thigh over here, or into the upper outer glute. My preference is, when I'm doing it by myself, is I actually use my upper outer thigh. I think it works much better. It's hard to use one hand to get into a shoulder, and it's also hard to use one hand to get into a rear end, and I'm not that flexible, so I can't get my hands around to work with it on my own. But I can very easily get into my thigh over here on this side. So I'm going to go ahead and show you guys how to inject yourself. Today I'm due for mine. So I'm going to show you how to do this, and it's very, very easy to do, and it is relatively painless. So I'm going to drop my drawers. Oh joy. I wore long undies today for this, so here we go. Upper outer thigh over here. And what I'm going to do is that same cotton swab that's full of alcohol, I'm just going to clean a big area up over here on the outside of my thigh. So nice and clean over here, big area, and we'll let that dry for a second. And we don't want to touch things with our hands after we clean it because we put bacteria on on that skin that we've just cleaned up with our hands. So we clean up things really, really well. And then injecting these things, you're almost going to hold it like a dart. And what I'm going to do is I'm going to pull this cap off, and I'm going to let Nick get in here relatively close so you can see. I'm just going to kind of just grab the muscle and just try to relax it as much as I can. I'm going to bring this over, then on the count of 3, it's going to be a real quick, just almost like a dart motion, really, really quick, right into the muscle. So what we'll do is on the count of 3, here we go, 1, 2, and 3. Okay, we're in. I'm going to pull back on this syringe just slightly. I get a little bubble at the end right there, and that's good. We don't want to see any blood. And now I'm just going to slowly inject the fluid in. Once it's all in, then we're out. There's usually not a lot of blood afterwards, maybe a little dot or so. And it's really not very painful, so these shouldn't be very terribly painful. And that's really it. So you can just kind of clean that little dot. You can put some a Band-Aid on there if you need to, but very, very simple to do. And they might have some soreness, maybe a little bruising at that injection site for a day or two. That's normal. Occasionally you get some pain, kind of going down the outside of the thigh for a day or two as well. That's also normal. Now, once you've injected, we have a couple of needles that we have that are now left over and or, what I would consider dirty. So what I want you guys to do is go ahead and pull these needles off the syringes, still with the caps on, and take these and go ahead and put them into a glass jar or something protective. And you can bring them to us to discard, or if you have access to what's called a Sharps container, it's a red medical grade biodegradable container that you can put these into if you're a diabetic or you have access to an insulin drop-off site. You can drop needles off, or again, put them in a glass container and bring them to us. Now, for you guys doing testosterone and the Arimidex, today is Tuesday. I did this injection on a Tuesday, and what we're going to want to do is most of us are taking the Arimidex or the anastrozole, which is an estrogen blocker, twice weekly. And what we're going to want to do is we take it on day 1 after the injection and then day 3 after the injection. So today being Tuesday, I'm going to take my anastrozole tomorrow. Doesn't matter what time or with food, empty stomach, doesn't matter. So you're going to take that anastrozole tomorrow, so Wednesday, and then 3 days after the injection. So I'll do it again on Friday. So each week then, I'll be injecting the testosterone once a week on Tuesdays. Wednesday and Friday, I'll be doing the anastrozole. And that's how we use these medicines. The testosterone does not need to be refrigerated. That's a very common question that we get. It does not need to be refrigerated. Some of the other medicines do, and if you've gotten those, I'll have separate videos available for that. But this is simply how to safely draw and inject the testosterone and how to use the Arimidex. If you have any questions, give us a call directly, 330-721-6504. You also have Nick and I's emails directly. You can email us directly as well if you have questions. And you can watch this over and over as much as you need to. If you just can't quite figure it out by watching the video, come on in and we'll run through it with you, but it's pretty simple.